Hey team, my name's Adam. If you don't know me already, I am a fourth year medical student, Rocky Vista University. Just matched pathology at the University of Michigan, AP/CP track. Very excited to get going. Today, wanted to just talk a little bit about away rotations because I get a lot of questions from students about how to prepare for them, what to do, what they're like, etc. And right now, I'm just taking apart a Lego set. Oh, geez, in preparation for my move. So I figured while I'm doing this, we could just chat about away rotations and kind of what to do. So just chilling. If you have any questions, feel free to leave a comment, or if you have my personal contact information, because probably the people who watch this know who I am, just send me a message. I did two away rotations in pathology. I did one at Johns Hopkins and one at Stanford. Both of them went really well. I had a great time, got some really positive feedback. And so I just remember being like really confused about what it was going to look like before I went, and being really intimidated because, especially because I come from a small private DO school, I didn't really know what the expectations were going to be like. I didn't know if people were going to be mean or what I should be doing. So it was kind of stressful. So I figured maybe if I can pass on some tips without breaking my Legos, that would be good. So a couple things. Here's my list over here about what we're going to talk about a little bit. I'm learning about video editing, so it's pretty exciting that I got me here and that right there. It's not good. I know that, and that's okay. Um, but first thing is preparation. How do you prep for your audition rotation? Um, and what I did, and what I hope that all of you were able to do, is I had like a elective in my third year in pathology. My third year elective, I would say, was probably ideal for prepping me for away rotations because it was community practice, just our local community hospital here, um, and it was general sign out. So I just had my preceptor who would give me like it was a month long rotation. For the first week, he would like he'd have me just like watch him. He had a double headed scope, and he would just have me sit there, and he would kind of explain to me what he was doing. I didn't do anything for the first week. And then after that, they had like a spare office with a microscope, and they set me up in there. And he would bring me like, I don't know, 10 cases every day with just like a sticky note on them of like some super basic history. And he's like, hey, see if you can figure these out. And I would just sit in there all morning and just try and figure them out, read stuff and get things wrong. And I would bring back sticky notes with my little stupid diagnosis. And for like an hour, hour and a half, we would sit at the double-headed scope, and he would tell me why I was wrong, which was great. I learned so much. It was a really great rotation. I got to see a lot of like breast and prostate and GI biopsies and stuff. So that was really, really great. And it just gave me a lot of confidence in speaking the kind of the language, I guess, like, hey, this looks blue, or hey, I think this is malignant because I've seen these before. I guess I should say, like, I hated pathology in medical school, like learning for like on PowerPoints and stuff was really tough for me for histology. I didn't like it. I didn't do a good job. But like everything I've kind of learned has been since that rotation. So don't feel if you feel like that, like don't feel like you're behind or anything. Like you can totally do a good job on these rotations, which is important because I would say that the letter that I got from Johns Hopkins was probably one of the most important parts of my application to residency. And so if you can get a letter of recommendation from these rotations, that's really, really helpful. So you want to try and do that. Oh my gosh. Sorry. Um, so there's that. Ideally, that's your situation. If you don't have that, there are other options to help you get prepared for these away rotations. So if you don't have the opportunity to do other rotations before your aways, like that's okay. You'll be fine. Don't sweat it too much. And I would say the number one thing is to make sure your licensing exams go okay. So you want to focus on those, and then if you have time afterwards, before your rotation starts, or if you have time right now, you can do some of this other stuff. So first thing I always recommend, if you don't have like an in-person elective that you can do, is here it comes. There we go. Pathology elective. So this is a fantastic website that I've used quite a bit, even though I had an elective. Dr. Cameron Mirza is right here. Him and Colin Lilly, who's over there, who's at UCLA now, I think. They put this together at Loyola, and it's super, super great. It's so good. It's just a bunch of modules that walk you through basic diagnostic principles, and it's essentially like an introductory elective. So if you have the time and you want to prep for your OA rotation, this is a great way to spend your time to get prepared. And I would recommend, I mean, if you know what your OA is going to be in, like say you're going to go do a neuropath OA, like do the neuropath one, obviously. But otherwise, like if you're not sure, if it's just like a general surge path rotation and you're not sure like what you're going to be seeing, I would recommend doing like the breast, the genitourinary, and the GI modules. That's most likely what you're going to see. That's kind of the most bread and butter stuff that we work with. If you have time after that, like ENT, head and neck stuff, I saw a lot, but you're going to see different stuff depending on where you are. So don't sweat it too much. Again, this stuff that I'm talking about right now is not the important part of doing well on an OA rotation. This is mostly like so that you, when you show up, you feel confident and you feel like you can be a contributing member of the team. You totally can be without this, but you need to feel that way. If you don't feel that way when you show up, like you're going to spend 3 weeks of your rotation getting comfortable and confident, and then you only have a week to do a good job. So that's not ideal. But anyways, so that's kind of what I would do to prepare beforehand. Not a lot. Again, this is not like a huge deal. It's not like you need to go read all of Robbins and Cochran. Although, if you want to, great book, would recommend. I'm going to hide this picture now. But Pathology Elective, just Google it, pathologyelective.com. It's great. Super helpful resource. Next thing I want to talk about is attitude on OA rotation. I would say that this right here is probably the most important thing in terms of like being successful, like getting positive things out of the rotation, learning, relating to people, making friends, making connections, getting a letter of recommendation. A lot of it's going to come down to your attitude. Because I know some medical students, like OA rotations are frustrating. You pay a lot of money. They're expensive. You travel. So in some cases, like you leave your family. Like I left my kids for like a month, right? And so sometimes medical students will feel like a sense of entitlement. Like, hey, I'm paying all this money to come here. You better teach me. You better make me included. You better do all these things for me. Which is, if you have that attitude going in, like you're going to have a rough time. It's going to be rough because that is not that's not what's going on there. What's happening is all of these people are very busy and very accomplished and very kind to allow medical students who aren't even from their institution to come and work with them and learn from them. And so it's really an awesome experience to be able to go to another institution and experience what they have to offer and what their place is like. And so you're a guest, right? That's the number one most important thing to remember is that you're a guest in somebody else's workspace. And so it's not about what you want, it's about what is offered to you, which is so great and so kind for people to help you out. So having an attitude of gratitude, right? Being grateful to be there and, being humble is a really important part, I would say. And along with that is a willingness to help, right? Like these people are working. They want to go home. The residents want to go home. The attendings want to go home. Like they want to do a good job. They want to help patients and then they want to go home. Like no one wants to spend an extra 2 hours explaining to you the parts of a microscope if you've never even bothered to Google it before, right? Like no one, if it's like, we'll talk about this more at the last section of questions. Oh my gosh, this is really just stuck on here. But like if it's 12:30, you've been in sign out with the attendings and the residents for 4 hours or whatever. Everybody's kind of cranky, kind of hungry, kind of tired. And you're on the last slide. You've already looked at 8 sets of prostate biopsies. You've been quiet the whole time. And then right when everyone's like, all right, that's it. Any last questions? And you're like, how do you know that this is prostate cancer? Like a very basic, very broad, very difficult to answer in a short amount of time question. Like that's rude, right? Everybody wants to go to lunch. You should have asked that question earlier. So just kind of recognizing like getting out of your own head a little bit and just being like, hey, everybody here is just at work and just trying to do a job. And I should be helpful and not in the way as much as I can. Like, obviously, you're a medical student, you're there to learn. Like, you do impede the process just by being there. But that's part of the game in academic medicine. But it's kind of how you go about that can make a big difference, in my opinion, on whether you're good to work with and easy to work with, or if you're a difficult person to work with. So I think if you're watching this video, like, you're probably already going to be a pretty good person to work with because you care enough to like want to know how to do a good job. So that's good. That's reassuring. But yeah, I just wanted to mention that as we go over some of this other stuff, and just like the attitude that you bring to the table is really important. So in terms of like, what are the actual things that you're going to be doing on a surgical pathology rotation? Now, it's possible that you just go to a rotation and you're just shadowing the whole time. They don't have you do anything, which would be rough. I didn't have that experience. But if that does happen to you, like, there are things you can probably do to mitigate that a little bit. But if you really are just stuck shadowing and you can't get out of that, and that's just what you're doing, like section 5, I'm getting better at this, you guys. You can't tell, but I totally am. Section 5 is probably going to be the most helpful part of this for you. Okay. One thing I wanted to mention that I almost forgot. If you wanted a letter of recommendation, let's bring that up on the first day, right? Like, first day of your rotation, figure out who your boss is, who's in charge of you for the rotation, the attending you're going to be working with most, whoever it is that you feel like would be most appropriate at the end to ask for a letter, bring that up on day 1. Be like, hey, I'm not really sure how this works, but I would love to get a letter of recommendation from this rotation. That would mean a lot to me and be really helpful. Is there any, like, what can I do to help that and make that happen? And that can just make the whole process a lot easier when everybody knows and is on the same page. That's what you want. Because a lot of people, especially in pathology, will go to these rotations just for an easy elective, right? Like, you being there does not necessarily just imply that, yeah, you want a letter and you're applying to pathology. Like, nobody's going to know that on day 1. As a quick story for that, I was on my first day in Stanford. And I like had to help somebody with something else. So I ended up being like late to sign out. And the person I was signing out with, super cool person who I was really excited to sign out with. I followed them on Twitter and I was like, kind of starstruck with this person that I was signing out with. And they like didn't acknowledge me for the first, like, I don't know, hour that I was in there. I didn't want to interrupt, so I didn't say anything. But they just assumed that I was just a student that was there like to get an easy elective, like wasn't interested. And after that first, like, I asked a question later that made him pause and be like, wait, are you applying, like, are you interested in pathology? And I was like, yeah. And then after that, like, it was a huge like shift in our interactions. So make sure people know, like, nobody's gonna, I didn't realize that people would not assume that that's what I was doing. So that's important to realize. Next thing. Jeez Louise, I'm just gonna leave that one for later. Move on to a different piece of Lego roof over here. So next thing, what are you actually doing? So ideally, if you're doing things, these are the 2 things that you are doing: previewing and sign out. Like, those are the main things. You might do some grossing too, but you're not gonna like, probably not gonna gross yourself. You might watch other people gross. I didn't gross. Some people do. But I think that's less important because usually you're not with an attending in that setting. And previewing, you're not going to be with an attending either. But what you do in previewing is going to directly reflect in sign out, which I guess if you're grossing, that will directly reflect in sign out too, probably. I just never had that experience, so I'm not sure. Anyways, previewing. A couple things here that I want to show you that we'll talk about. Boom, boom, boom. Okay, so these 3 things are your best friend. And pathology is the best specialty, in part because when you are working, you are alone for a lot of the time. If you don't like that, it might not be the best specialty, but I like it. It's sweet, especially on an away rotation when you don't know what's going on and you need to read to figure out what everybody is talking about because you can't figure it out. So luckily, on pathology away rotations, you have a lot of time to do that. How my rotations were structured, and how yours will probably be structured, I would imagine, is that the residents would assign me like a couple of cases every day when I would start. They'd be like, hey, take these 2 cases, go see what you think, write them up if I had access to the EMR or whatever, or find a diagnosis, and then like, If you have questions, come talk to us. So I would have like 3, 4 hours a day that I was just on my own um, to start. And like 3 to 4 hours is a long time to do 2 cases. That's a very long time. And if you've never looked at specimens before, like you might need all that time. If you don't need all that time, one, you should do a really good job. And two, you should ask for more cases. I always ask for more cases. And one, I'm paying a lot of money to be there. I don't want to like not do anything, be on my phone or whatever. Like you should get your money's worth out of the experience. And two, like you want to look good. You want to help out. Like I did it partially because I wanted to impress people, but also because like me being helpful helped everybody go home a little bit earlier and like not have to work so hard. So we're all a team trying to help out the team. Anyways, so you're previewing. You get handed these 2 cases, and one of them is from a nose and one of them is from a pancreas. And you, even though you did what we already talked about and you looked up uh, GI biopsy stuff on Path elective, and you did modules on genital urinary stuff, and you already did an elective in your 3rd year where you saw a lot of breast pathology. You've never seen anything from a nose or anything from a pancreas. Shoot, my first day, I'm gonna screw it up because I don't know these things. You'll be fine. A big part of this whole process is like learning how to read. Like you know how to read, but learning how to like find stuff you don't know the answer to. And these resources are my favorites for doing that. So first, this blue book right here next to me, it's next to me because it's my favorite. This is Malavi's Practice of Surgical Pathology. It's like the introduction one. Practice of Surgical Pathology, A Beginner's Guide to the Diagnostic Process is what it's called. You can find it on Amazon. You should buy this book. This book is awesome. Okay. This was written by a Hopkins, I think she was a resident when she wrote the first one, but alum at this point, based off of like kind of when she was a senior resident at Hopkins, the kind of intro boot camp lectures that they would give their junior residents. So it's directed to people who are seeing stuff for the first time ever. Not so much like normal histology, although there's a little bit, but really it's like, it's just so good. Like what I would do if I got a new specimen that was like nose, and I had never seen a nose thing before, I would go like skim read the whole chapter on the nose in this book, which would give you a great outline for like what you should be looking for. And then, so I would look at the specimen first, get an idea of like generally what I think is going on. Like, oh, this is obviously really bad cancer, or this could be benign. I don't really know what this is. Anyways, very basic. Then read this chapter real quick, and then go back to the slide, look at it again, see if anything jumps out now that I've read that chapter and looked at some pictures. If not, try and get a little bit of a better idea, like, is this cancer, is this not? And then what I would usually do is I would go to Kurt's Notes. Kurt's Notes is another excellent resource. I love Kurt's Notes so much that I took like the whole website, I printed out the PDF. So I have like a physical copy of Kurt's Notes. But this is just a website. Go to Kurt's Notes. And Dr. Shaberg is faculty at, I think, UC Davis. And this is just a wonderful guide that's super helpful, very succinct, easy to read. So you would just like open up the nose thing in that website, and you would look up, like it's just like a PDF. It shows you like a bunch of different diagnoses. So you would like scan that, look at the images, and I would see if any of the images in Kurt's Notes look like my slide. And that's kind of where I would get started. And then usually that's adequate. Doing that and then looking at the slide. If I'm like unsure and I want more information after that, I used Pathology Outlines, which is like over there. Pathologyoutlines.com is a hugely awesome free resource that you can use. Up at the top on the website, you can see I circled it in red. There's that little textbook link. You click on that and it takes you to like, all the different organ systems, and you can go that way, or you can search in the search box whatever you think you're dealing with. It'll give you a ton of pictures. It'll tell you about different stains you can use to figure stuff out. It's just so helpful. So I was on these 3 resources like all day on my OA rotations. And then, in my opinion, one of the most important things about previewing is then you just guess. Like after you did all that, then you come up with an educated guess of what you think is going on and you write it down. And you do not change that guess. Even if you go talk to the residents and you're like, hey, I was thinking this is what this is. And they're like, that's not what that is. It's this. And they tell you something different. Don't change what you wrote down. Keep what you wrote down. Because one of the biggest pieces of feedback that I got on my rotations was the attendings just loved that I was willing to try things, that I would just do it, like write it down. I'd be wrong. Like, I don't care about being wrong. You're a fourth year medical student. Nobody expects you to know anything. Like, the bar in pathology is so low for what you should know. But what they really want to know is like, how do you handle being wrong? When you're wrong about something, like, are you kind of a jerk about it? Are you going to argue with the attending when the attending tells you what it actually is? No, you're not. You're going to be really humble about it, and you're going to say, oh, wow, thanks for teaching me. That was great. Your goal as a trainee is to get as many things wrong as possible in front of other people before you're a pathologist and nobody is looking at you over your shoulder, right? So you want to just get them wrong now, is my philosophy. So yeah, that's kind of the biggest thing that we needed to talk about today, is like how to preview, what resources are helpful. I love these resources. Next, the other big part of your day is going to be sign out, where you're going to be sitting in a chair looking in a multi-headed microscope with the residents that are on your service and the attending. And I just feel like this should be easier to get off of here. I even have the little tool. I'm just having a hard time. We'll do that later. Anyways, you're seeing a multi-headed scope with the attending and the residents. This time is for you to listen for the most part. What I tell people is your goal should be during sign out to have 2 thought out questions to ask. Like, this is not about you. This is, you get to be there while they do sign out, really. So if you don't say anything like the whole sign out, other than thank you for letting me attend at the end and introducing yourself at the beginning, that's great. Like, that's okay. It's not ideal, maybe, so it's not great, but you can do that, Shouldn't do that every day, but like, you go a day and you're like, I don't really have any questions, kind of went over my head. I'm just kind of trying to soak it in. Like, that's okay. And you can kind of pick up from the vibe of the attending of like how much of a rush they're in and how willing they are to like take time to explain things to you on your level. But what the sign out is really for is it's for the attendings to teach the residents. So you're kind of just soaking that in. So if it goes over your head a little bit, like, that's okay. So ideally, like, what I loved to do is like, I would preview my case and I would have a diagnosis and I'd be pretty sure, like, at least it's cancer or not cancer. And I would come up with a name for it. Like, you want to be as complete as you can when you come up with your diagnosis, even if it's off base. And I would know that my diagnosis was probably going to be wrong. So I would expect the attending to explain like what is actually going on. So what I liked to do is I liked to prep kind of other questions. Like, if you're looking at the case and there's like a weird like artifact that like, it's not part of the main case, but you see something and you're like, I don't know what this is. I don't know if it's important. Like, oh, what a great question. What a great question to ask and sign out, because one, it shows that you know when something doesn't belong and when it's different from the rest of what you're looking at. And 2, it shows that you actually looked at the whole case, that you didn't just glance at it, because that's really important. We didn't even talk about that. Like, when you're previewing, you need to look at all of the glass that they give you. Because if you look at the first slide and you're like, oh, this is obviously ductal carcinoma in situ or whatever it is, like, and you happen to know that, but like on the 5th slide, there's like a really serious invasive component of like a different cancer or something, and you didn't even see that, like, oh, that's so bad. So make sure you look at all of it. Be thorough. You have time. So yeah, that's pretty much it for sign out. Just like, again, the attitude thing, asking good questions. And I'm sorry that this has been kind of rambly. I want to be kind of complete with this, so it's kind of a long video. I'm not in this to like expect my channel to like do anything, so whatever. Anyways, just kind of my thoughts as I take apart my Legos. So my last thing, questions and other social things. I touched on this briefly, but just asking good questions is such a big deal. Like, if you can put together a couple like coherent, well thought out, like at level or above level questions, like, that's really great. And then you listen to the responses. You have a little notebook if you bring a little notebook with you and you write down answers in a little notebook, like that's great. I know you can take notes on your phone, but you just never know. Some attendings are just weird about that kind of stuff. So I like to have a little notebook just so that everybody's cool with me having, that as opposed to typing on my phone. You never want to be on an away rotation to be typing notes on your phone and have an attending tell you to get off your phone. Like that's embarrassing. That's weird. You don't want to do that. So little notebook's good. Um, let's see, other social stuff. Oh, I remember being a third year medical student prepping for away rotations, and I heard a lot about like the beer test. Like residents want like a fellow resident that they would go get a beer with, which I think is valid. But I want you to know that like no one ever asked me to go get a beer. Like I never hung out with residents after hours. And I remember at the time being like a little bit stressed about that. Don't be stressed about that. These people are busy. Um, Not everybody's gonna be your best friend. So like if people are cracking jokes, like join in, have a good time. But like don't feel like you have to force best friendships to happen. Like just be a normal person going to work and don't, make any like don't make any off-color jokes, obviously. Like be professional and be kind and be thoughtful of other people, and that's gonna be a big deal. So um yeah, that's my main stuff. I'm trying to think if there's anything else. I just think that away rotations are kind of scary, but in my experience, at least in pathology, again, I was so nervous because of my kind of rinky-dink medical school, compared to these big ivory tower places I did rotations at, and everybody was just so nice. Like I was blown away everywhere I went that just everybody was super kind. So don't feel like you got to be weird or competitive or prove yourself to anybody. Like people are nice, so just be nice, and that's really important. I have another video planned kind of closer to summertime where I'll talk about interviews and how to interview for pathology residencies. In the meantime, let me know if there's any other videos that you would find helpful. Anything else that I can do for you guys. Again, super easy to get a hold of. I love chatting with students. Big passion of mine. So also when I'm at Michigan, feel free to reach out to me. My information should be publicly available on their website. So yeah, anyways, have a great day, everybody.